I'd now like to call on Dr. Seidel to address us.
Thank you very much, Zina, and thank you, Minister, for your kind words. I also want to acknowledge Minister Wyatt, who is with us today. I do want to acknowledge the Shadow Minister for Health, Catherine King, and I do want to acknowledge my local member for Franklin, which of course is the most beautiful electorate in Australia, as you would all know. And Julie Collins is of course also the Shadow Minister for Mental Health. So thank you very much for coming and attending this event today. Now, as you would know, general practice is indeed the largest medical profession in Australia, and the RACGP does indeed represent over 90% of clinical GPs here in this country. And as you would also know, 85% of all Australians are seeing their GP at least once a year. That's way over 135 million services per year that are being rendered by GPs. That's almost over 400,000 services on a daily basis. So when we talk about the health of the nation, it should be very clear that GPs literally take the pulse of the nation on a daily basis. So general practice is, of course, worthy of comprehensive and reliable research. And today I'm absolutely delighted to present the highlights of our inaugural Health of the Nation report. The RACGP Health of the Nation will report annually on trends across general practice, and it will identify emerging as well as current challenges for GPs, patients, and of course for policymakers. Now, the RACGP is an academic medical college. We are not a lobby group. We don't have a checkbook. But never mind, this breakfast is actually being paid for, so you are fine for today. But again, we don't have a checkbook, but we can't help ourselves arguing with evidence-based facts. We explain facts. We don't make them up. And facts can at times be confronting, but they inevitably guide us away from palatable spin towards solving the real and relevant problems our health system and our patients face. And they face those problems on a daily basis. Facts help us to focus, and they help us to maintain perspective. So the Health of the Nation report you have with you today, report actually contains over 30 pages of facts. That's actually less overwhelming than you may think, and feels free to skip page number 1 unless you are desperate to have yet another high-resolution photo of me, in your back pockets. That's fine. So, but again, this morning I will just present the highlights of the report, and I will promise I will not have more than 10 slides. Patients access GPs more than any other part of the healthcare system. And as I mentioned before, 85% of all Australians are seeing their GP at least once a year. 75% of all Australians can nominate their GP. That is a person. That's their doctor. And if you're over 65, 90% of people over the age of 65 can identify their GP, not one GP. So that's the access, of patients, to see a general practitioner. And that's great because we actually believe that patients want health and not necessarily treatment. And you can clearly see that those consultations patients have with their GP actually do not lead to, prescriptions for medication or, a pathology test or an imaging test. That's not the priority. The priority is the consultation with the doctor. And it's very clear that GPs are indeed very much accessible. Again, 85% of all Australians are seeing their GP at least once a year, and so they should. Minister Hunt already mentioned the problems we face in rural areas. But again, if we have a look at the facts, we can see that GPs are indeed consistently accessible across all remoteness areas. The numbers are very clear. They're accessible in major cities, in inner regional areas, in outer regional areas, such as in Huonville, where I practice, and indeed in remote and very remote areas. So the bottom column here is really the general practitioner. The problem indeed is non-GP specialists, who are actually less accessible the more remote you are. So GPs are indeed not the problem when it comes to numbers. Now, out of personal experience, the problem is the tyranny of distance. So I work in Huonville, as I mentioned before, Australia's southernmost electorate and council. And of course, I do provide palliative care services. And that means I'm driving 70 kilometers to see a patient at night to provide palliative care services at home. And that's one way. So yes, it's accessible for this particular patient, but it's very, very difficult for me to do this consistently on a daily basis. So it's an access issue via distance. It's not in terms of actual number of GPs you have in rural areas and in remote areas. And also, most patients can see their GP when they need to. This is really important because there's the myth out there that people say, I can never see my GP and it's really difficult, and therefore there are other health practitioners who say, well, you need to see us instead because you can never go and see your GP. That's actually not the case. 75% of all patients who need to see a GP can see a GP within 24 hours. That's the fact. 75%. That's slightly different in outer regional and remote areas. But again, the figure is way over 70%. So 85% of patients are seeing their GP at least once a year. 70% of them can see their GP when they need to see the GP within a 24-hour period. And patients report positive experiences with their GP. When we ask them, does your GP listen carefully? Does your GP show respect? Does your GP spend enough time with you? The answers are consistently yes, indeed. And the figures are close to 80%. That's why GPs in general have an overall approval rating of over 90%. Now that's a figure all politicians here in this room can only dream of. So we must be doing something right in that respect. So it's a positive experience when you're going and see a GP. But as Minister Hunt mentioned earlier, it's not musculoskeletal problems patients are presenting to their GP with, the majority. It's not cardiovascular disease. It's not necessarily respiratory conditions. The stock standard medical presentations we always heard about. It's indeed psychological issues we GPs are dealing with most of the time. Now, why is it? Psychological issues don't present in isolation. People don't come in and say, I just have depression and nothing else. Of course, I have other medical concerns as well. In my practice, it's the patient that has multiple sclerosis, and I've seen her for many, many years. And she experienced domestic violence at home, which I only picked up because her MS symptoms got worse. And I asked her, what's actually going on here? And she opened up what was going on. And of course she is depressed. And of course she is anxious. And of course she can't take any medical treatment for her anxiety and depression because she has multiple sclerosis and she's on treatment for that. And of course she can't work because of her MS. And she can't afford to see a private psychologist. And of course she can't afford to see a psychiatrist. But of course she wants to see me as their GP because I'm treating her anyway for her MS. I'm seeing her on a regular basis for this. And of course it's me as a GP who is going to offer psychological treatments for her. And I can, because all GPs are trained in doing this. I can't send her to a headspace unit just to deal, with her depression and anxiety. I can't refer her just to an app to have some online counseling. That's not the level of comprehensive care GPs offer. We don't specialize in one particular condition or one particular disease. We are specializing in our patients. So this is this patient with MS who I see. It's also the patient who I've seen once a year. the gentleman who first saw him when he was in his mid-40s just for health checks. And he was great, very proactive. And, his blood pressure was fine, his cholesterol is great. Yes, we checked his prostate, and, he was a hardworking man. And then he had a brain hemorrhage out of nowhere. And he couldn't work anymore. He was lucky to survive the multiple operations he had. And then he just wanted to go home again, back to his GP, who he knew quite well from all those health checks we did. And he knew he'd never had a chance. It was impossible for me to pick up a brain aneurysm, and you wouldn't screen for that either. But he can't work anymore. He can't drive anymore. Family of 2. Income protection doesn't want to pay for multiple reasons. Is he depressed? Of course he is. Is he anxious? Of course he is. Does he have days where he thinks, well, why did I bother surviving my brain hemorrhage? So who is going to do the mental health consultations? Of course it's going to be me. Of course there's no app for this gentleman. And of course I'm not going to refer him to any particular psychological or psychiatric specialist, because he doesn't want to talk to them. He wants to talk to the GP he trusts. The GP has looked after him for many years. So again, bear in mind, when we talk about mental health conditions, they don't appear in isolation. Health is complex. Humans are complex, and we need to be treated accordingly. And we need to have a system in place that's allowing patients to have this comprehensive treatment available. And that, of course, in those 2 instances I mentioned, is delivered by GPs. So look at the workforce, though. Our workforce is changing. Minister Hunt referred to the training of GP registrars. General practice is increasingly female. I think that's a great thing. And it's absolutely fabulous to see, having a medical specialty that's extremely attractive to our female graduates. They're actively choosing general practice, not because it's convenient, no, because it's a great specialty where it can offer comprehensive care, where you, as a female medical graduate, can multitask because you're really good, so much better than your male counterparts are. And we need to be ready for this, because this is a good news story. What's not a good news story is that the average income of a female GP is $50,000 less compared with their male counterparts in Australia. What's not a good news story is that the average income of all GPs is less than half than the average income of a hospital specialist. So if we want to attract the best and brightest to our profession, we've got to have a bit of a think about how we are going to fund those medical specialists who are offering the comprehensive care, who are being seen by 85% of all Australians at least once a year within 24 hours when they think they need it. And general practice is the bottom basement margin of the century. Only 9% of total government expenditure goes into general practice. And you argue, oh, that's still $9 billion. Of course it is. But per person, that's $375 per year. That's $31.25 per month. That's cheaper than a subscription to the Australian. It's around about $1 a day. $1 a day for general practice. And compare that to other expenditures. Hospital funding is half. It's $49 billion. Half of the federal government health expenditure goes straight into hospital systems. That doesn't even take into account what the states contribute. It doesn't even take into account what the private health insurance contributes and the patients contribute themselves when they go and see a hospital doctor or seek hospital treatment. So if you want to have a sustainable healthcare system, we've got to have a look how we fund this system that's meant to be the backbone of healthcare in Australia. And we can't do it for $1 a day. Let's be realistic about it. We just can't do it. And currently, we can't do it any cheaper. And bear in mind, general practices here in Australia are actually small businesses. We round about have 6,000 general practices. And on average, we have 4 to 6 full-time equivalent GPs working in those group practices. Only 10% of all GPs work in so-called corporate medical practices. So they are small businesses. And try to maintain a work-life balance if your patients want to see you and you want to make sure they approve of the way you are treating them and you want to make sure they're accessible. Of course, maintaining a work balance is a nightmare. It's extremely difficult to do. 47% of all Australian GPs work more than 40 hours every week. 7% work more than 60 hours every week. That's just not going to be sustainable. You can't have tired GPs dealing with complex issues on a day-by-day basis for $1 a day. It's not going to work. So when we say, practices are struggling maintaining a cash flow, well, that's because of it. Because again, if bulk billing numbers are really that high, and if they're indeed 80%, the income for those practices is indeed limited. It's indeed limited. And why are we bulk billing patients? Well, we bulk bill patients because they can't afford any out-of-pocket payment. The palliative care patient I see who lives 70 kilometers away from me, am I seriously going to ask them, to pay an out-of-pocket fee for my home visit? He's 88. His wife is 84. Am I going to take my FPOS machine to the nursing home to ask for a co-payment? Of course I'm not going to do it. It's unethical. But there comes a point where we have to think of how we fund general practice better. And this is the concerning graph. Bulk billing numbers are not a good news story. Out-of-pocket costs that continue to rise are the story of the day. Because out-of-pocket costs have risen 4.8% in the last year alone, significantly more than CPI. Something is going on out there. And there comes a point where patients won't be able to access GP care anymore. And if you look at the data from the Australian Bureau of Statistics, we already know that 5% are actively avoiding to see their GP because of increase in out-of-pocket costs. Now, they're not getting better overnight. Their medical conditions don't disappear. So where are they going to seek access? They're going to end up in a public hospital emergency department. And the cost to the taxpayer is not $37.05 for the standard Medicare rebate, it's $250. And if they don't go to the emergency department, they're calling the ambulance service out. And the cost to the taxpayer is $800. So we can't be penny wise but pound foolish. It doesn't really make any sense. We need to have a common sense approach of how we make general practice accessible, how we maintain accessibility for patients to see their GP. Because if you are unwell, you need to be seen, and ideally you are going to be seen by the medical practitioner you trust, and patients want to see their GP, full stop. And the checkbook should not determine access to an extraordinary GP service. So when we ask our members what are the pressing issues, never mind the re-indexation of Medicare rebates. The issue is the actual rebate itself. Who decided a Medicare rebate for a standard consultation is $37.05? That doesn't make sense. It's an arbitrary number. We need to have a look at the value to patients, to communities, and to the health system at large. Because the Medicare rebate is not the doctor's rebate. It's the patient's rebate. It enables the patient to access medical services in general practice. So again, we as GPs know that the Medicare rebates level they are now are not going to be sustainable. We need to look at increasing them at some stage if we want to avoid increasing out-of-pocket costs. And we need to have a look at them at some stage if we want to maintain an equitable healthcare system, whether we like it or not. Can we afford it? Absolutely. If we currently spend $31.25 per person per month, certainly we can increase it. In particular, when half of your budget is being spent on hospital care that we are trying to avoid and reduce in the first place. We want to make sure patients are going to see their GP. because we know that continuity of care is reducing admission rates, it's reducing readmission rates, and patients are going to live longer. So it's to the benefit of all. And yes, we also know that apart from Medicare rebates, mental health is certainly the big issue we are seeing now over and over again. And again, we need to have a look at how we are supporting general practitioners, to actually offer mental health services. To me, it is, I need more time. I don't do 6-minute mental health consultation. It doesn't exist. So how do we allow GPs to spend more time with their patients? And we need to have a grown-up discussion about how we make funding available to do this and how do we have backup systems in place to allow this as well. We want patients to see their GP. We don't want to refer them to an imaginary app, on the internet. That's not going to help them in the long term. We don't want them to be seen by a psychiatrist because they're ending up not with one antidepressant now, but with 2, potentially some sedatives and some antipsychotics as well. And the side effects or complications, again, have to be dealt with by the general practice workforce. This is just now a couple of slides before I conclude on the emerging issue of after-hours services. And you won't find those slides in your report because they are just fresh from the Australian Institute of Health and Welfare. And I'm sorry that you can't do it really well. But what it actually shows is in-hours emergency department presentations from 2006 to 2016, and we are seeing after-hours emergency department presentations. So we actually see a steady sort of increase there, and then pretty much, a steady line from 2011 onwards. The argument by after-hours, GP-type providers has always been that they're actually preventing hospital admissions and they are preventing A&E presentations in the after-hours period. That's been the argument. And again, if we have a look at the inconvenient facts, that's not the case, because that's been steady. But that's the increase in urgent after-hours attendances in the same time period. Not a 5% increase in Canberra, not 50%, not 100%, not 500%, a 1,500% increase in urgent after-hours cases in Canberra. To me, that doesn't make any sense. So we really need to have a look at it, how we can rein this in. We know if you want to have sustainable health funding, for quality general practice, this is not sustainable anywhere form. It doesn't make any sense. And it's costing the taxpayer $250 million every year that should be redirected to quality general practice. And we are already doing a good job. As I mentioned before, 75% of all patients can see their GP within 24 hours. Actually works quite well. We've extended our opening hours. I start at 8 o'clock in the morning. I work on Saturdays between 8 and 4. It's 6-day access. I was overseas, but I have email available, so I communicate via email with patients. I check pathology results online because I can. So there are various ways of how we have access, to patient care. It's not necessarily face-to-face, but again, it's still access, to the GP, and for me, it's still access to my patients. So again, there are only 3 key messages because I want it very, very simple. Mental health is today's biggest health issue and will continue to be an issue in the future. And we need to tackle this now, not in 12 months' time. We've got to act on it now. Act on it now. And bear in mind the GP is and remains the most accessible health professional and should be utilized to ensure, the health of our nation. We actually have a track record of doing this already. But out-of-pocket costs for patients in general practice are increasing, and that's going to be an ever-increasing barrier to patients accessing the required care. And that's something to be aware of as well. And if you want to rein in out-of-pocket costs, we need to have a look at Medicare rebates. Thank you very much.